All right, hello everyone, and welcome to this information session offered by the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. My name is Sally Safi, and I'm the Director of Graduate Studies in the department. And we're really excited that you all are here and you've joined us today to learn a bit more about the department, the programs we offer, and how our students engage in work with our faculty. So the session is an hour long, and this is our agenda. I'm first going to give a really quick introduction to the department, and then we'll spend the bulk of our time together today hearing from current students and faculty about their research. They'll discuss a project on which they collaborate to give you a sense of the opportunities beyond the classroom that are available here for students. And after we hear from them, I will stay on to share information about our degree programs, including our Master of Science in Public Health program, the Accelerated Bachelor's MSPH program available for Hopkins undergrads, and our Master's in Health Science program. So feel free to ask questions at any point during the session. You can drop it in the chat. We'll try to keep an eye on that, or just raise your hand and come off of mute. So the department is one of 10 departments at the School of Public Health here at Johns Hopkins, and the department has a long and rich history. So decades ago, the Department of Population Dynamics merged with the Department of Maternal and Child Health, and we became PFRH. And the work of the department is diverse, but we're united in our focus on promoting health and well-being across the life course. So we use a multi-level life course framework to understand public health issues and the interplay of biological, behavioral, societal, and other factors across a person's life and across generations. And this framework helps us to advance health equity through effective public health research and practice. Students in the department select an area of interest within PFRH to drill down on a focus area. These four areas are shown here on the screen. In practice, there's a lot of overlap of these areas, so courses that we offer fall into multiple categories, and faculty work does not often fit neatly into just one of these boxes. But rather than constrain students, these areas are meant to help guide you, select courses, and refine your interests while you're here studying public health. So today I think we'll probably see themes from multiple areas, but I'm also expecting some discussion about women's sexual and reproductive health. So like I said, at in about a half an hour, we'll turn to discussion of the PFRH degree programs and the application process. But right now, I'd like to turn the discussion to our student and faculty. So I'm going to stop sharing my screen. And I'm delighted to welcome Dr. Kristen Bevilacqua and Georgia Laverly Van Paris. I hope I said that right. Correct me if I'm wrong. And so to kick off our discussion, could the two of you introduce yourselves and share a bit about your public health interests and expertise? Do you want to go first, Georgia?
Yeah. Okay. Hi, I'm Georgia. You said it pretty well. It's Georgia Labrie Van Paris. Always trips people up. But yeah, so I'm an MSPH student in the Department of Population, Family, and Reproductive Health. I am specializing in the women's sexual and reproductive health. Do you want me to go into my research interests now?
Yeah, if you want to just say briefly, that'd be great.
Yeah. So, I think broadly, I'm kind of interested in violence prevention, sexual and reproductive health, and how public health research can actually translate into real world policy and programs. A lot of my work is focused on gender-based violence prevention, especially in institutional settings like colleges or community programs, and understanding how we can create environments that are safer and more supportive.
Great, thanks. Dr. Bevilacqua?
Hi everyone, I'm Kristen. I'm an assistant scientist in the department. That's like confusing to people what that is, but basically I'm a non-tenure track junior faculty. Um, and I actually did my PhD in the department, so I've been here about 6 or 7 years. And my research broadly focuses on gender-based violence, and specifically sort of the intersection between violence against women and migration. But I work across a diverse portfolio of projects, and we're going to talk today about one project that Georgia and I work on together.
Awesome, thanks. So could you tell us a little bit about that project?
Yes, I can. This project is a CDC funded evaluation of the impact of alcohol-free programming on sexual violence on two college campuses here in Maryland. So, it's been an ongoing project. I sort of came in midway as an assistant scientist, although I worked a little bit on it here and there as a doctoral student. But basically, we worked with two campus partners and we implemented this alcohol-free intervention. So, once over the last 2 years, like once a month or so, it kind of depended on the campus, they would implement sort of an activity that was specifically alcohol free. And then we are evaluating if we saw less sexual violence on those weekends. And there's other components of the study, but that's really the most straightforward way of explaining it. So we recruited a cohort of students and we followed them over the school year. And the idea was even if they didn't attend the event, we want to see if there was sort of like this diffusion of less alcohol use, lower risk of sexual violence. And there were also, at the end of quantitative data collection or after sort of the year of implementing that intervention, we also did qualitative interviews with students.
Great, thanks. Could you talk a little bit about your roles on the project and exactly what you're doing day to day, and how the two of you collaborate on the project?
Yeah, I can go first. So I'm a first year student, so I came on earlier this year in October, November time. And so my role on the project focuses on analyzing the in-depth interviews with students that Kristen was just talking about. These interviews explore things like how students perceive the campus culture, their experiences with prevention programming, and how they navigate systems related to safety, reporting, and support. So I work with interview transcripts and we use qualitative methods to code and identify patterns and themes across the student experiences.
Thanks. Is the goal to create a manuscript at the once you've analyzed the data, or what are could you talk a little bit about the products that you all are hoping to develop and how you'll disseminate that information?
Sure, it's a pretty long-term project. There's actually a few published sort of pieces that have already come out of it. But more broadly, we're interested in environmental and situational strategies for preventing violence. So, how can you change the built environment, the situations that students are finding themselves in that might put them at risk for violence? So, we sort of narrowed in on alcohol use or exposure to folks who've been using alcohol, but there is sort of this more overarching environmental focus. And so the portion of the study that Georgia works on will eventually be a publishable manuscript, but it's also a component of our final report that will go back to the CDC, and then also individual reports that we'll send to our campus partners that are specific to the results that we found on their campus.
Thanks. Georgia, could you share how you found the position?
Yes. So we have advisors. Everyone in the program has advisors, and so I'm Kristen is my advisor, and we had met and I had talked a little bit about my previous experiences working in this area in undergrad, and kind of just stated my interest in doing similar research, and so we were able to get connected just over like email about this opportunity, and it kind of worked out really well.
Great. Did you have qualitative experience coming in, qualitative research experience?
Yeah, I did. I had done some research previously with sexual violence on college campuses as well. So
Okay,
it was a pretty nice
a
transition.
good fit. Yeah. Are you planning to take coursework in qualitative research methods while you're here? Is that like a specific interest of yours?
Yes, I actually just spent the morning starting my qualitative research class.
Awesome.
Yeah, so I'm taking the online qualitative research methods class. We're learning about, focus groups, interviewing methods, coding methods, stuff like that. So great class so far.
Great, thanks. I would definitely want to give participants an opportunity to ask questions. So I hope you all are thinking of what your questions are, and we'll have an opportunity for you to ask those. But maybe my last question is, if could you talk a little bit about the public health impact of this project, and the intended outcome of the research?
Sure. So historically, the GBV sort of prevention field or sexual violence has focused a lot on maybe individual level risk factors. So, what about individual women might put them at risk for sexual violence or potential perpetrators for using violence? But this is sort of taking kind of a new path and thinking about maybe how our environments shape our risk outside of our individual identities. And so the idea is to kind of take it a step forward and show how more broadly how the environment or situations that people are in affect their risk for sexual violence. And then when we're talking about this evaluation, to sort of show if these alcohol free events or nights or whatever on campuses might be able to actually make a difference in terms of sexual violence risk more broadly. And so the idea there would be um, to disseminate these results to other college campuses and universities and see if it's an intervention that's feasible for them, something that they might want to implement. So, sort of a diffusion of this idea that you can do education around sexual violence, you can do bystander training, all of these things, but there might be sort of this whole swath of environmental and situational risk factors that we're not quite getting at yet. And maybe this is one of those modifiable risk factors that we can work on at a campus level.
Thanks. Do either of you have any findings at this point that you found really interesting or maybe surprised you?
From an evaluative standpoint, we actually have not found an impact of the alcohol-free programming on sexual violence risk. Um, but we're sort of working through that and thinking about why that might be. Was it that it didn't really diffuse in the same way that we expected to? Our sample is not, it's not probability based, it's a convenience sample. So it could just be the folks that came into the study maybe were already less at risk of violence for one reason or another, and that influenced both their their risk of violence, but also their participation, let's say, in the study. So we're still sort of working through that and trying to think through why we might not have seen results. And maybe if the intervention needs to be tweaked, or maybe if there's a different sort of direction that we need to go in terms of environmental prevention.
Thanks. Well, and it's great that you have the qualitative data so you can dig into the interviews and see what students are saying about the intervention. Do our participants have any questions for our presenters? This is your chance to ask anything at all. Feel free to come off of mute or type in the chat. Ellie, I think I might have seen you come off of mute. Do you want to ask a question?
Yeah, I have a question, specifically about the Masters of Science in Public Health. I'm curious what you and your peers are looking at long term for your career, which I know isn't related to your research, which was super interesting and I really appreciate hearing about. But I'm just curious about what you guys are planning on doing with your career after the Masters.
Thanks. Georgia, do you want to take that? Do you have thoughts?
Yeah, I can try. So I think coming into the master's program, I came directly from undergrad, and I didn't really have much of an idea coming into the program. I knew I enjoyed research, but I had pretty limited experiences. And so we have, as part of the program, an opportunity to do a field placement, so an internship in the area, which begins summer, goes into fall. And so I'm really hoping to use that as kind of an opportunity to, explore more opportunities, and kind of see what it's like working in the real world outside of an academic institution. So yeah, I've been really interested in policy work, kind of the intersection between policy and research. So I don't have honestly a firm answer to give you, but there's a ton of different opportunities, and kind of areas to get your feet wet in this program. And so I kind of have just been trying to explore as much as I can, doing some more like legislative stuff. I'm doing a gun violence internship as well as this research project. And so just trying to keep options open. I've enjoyed everything I've done so far. So I just have to kind of narrow it down now.
Okay, cool. Thank you.
Thanks. I love that answer, and I think it's fairly typical of students who come to our master's program where I think you have deep interests in public health that align with the department, but you still want a chance to do some exploring. So I'll be excited to circle back to that question with you around this time next year and see what you're thinking, see what you've gotten out of the field placement. But I think that the a great benefit of coming to Hopkins is just all of the opportunities that are available and the networking that you can do to just explore and find out where you might want to land after this. Yeah, so Love, I see your question about the application. I'm going to talk a lot. I'm going to talk about our programs and about the application process. We'll get to that in just a little bit. I'll go back to the slides. And then I see another question. I think it came just to me, but let me read it out loud. This is to both Georgia and Kristen. Are there any community partners or faculty at other Hopkins schools that you've been working with or been in contact with during this project? So community partners or faculty at other Hopkins schools.
Yeah, so for this project, our two primary community partners are the college campuses that we work with, but we also work with the Maryland Coalition Against Sexual Assault, MCASA. So they sort of consulted on the conceptualization and the implementation of the research. So yeah, we do a lot of community-based work in our sort of research group and at the center where I work for the Center for Global Women's Health and Gender Equity. So in terms of folks across the university, not necessarily for this project, but for other projects, we do a lot of collaboration, especially with the School of Nursing, because they also have a big gender-based violence, violence against women research program. But yeah, there's always opportunities to work with folks in the School of Nursing, in the School of Medicine. And then, Baltimore is a big community organization sort of city. There's always those sorts of opportunities. And there's actually an office here called Source that's dedicated to linking students with community service and not necessarily just service, but community work. So that's a big opportunity here at the school.
Thanks. I'm going to put a couple of links in the chat. I see Mary Alice put in some links of community partners. I'm also putting in the link for the Center for Global Women's Health and Gender Equity, which Kristen just mentioned is a center that she's affiliated with. And the center, and all centers at Hopkins, I'll show a slide in just a bit about various centers that are sort of based in our department, but they really serve as places to foster collaboration across, like, within the department, within the School of Public Health, but also across other divisions, and engage with people, as Kristen said, like from the School of Nursing or School of Medicine. So I'd encourage you to look at that center and the other centers on the PFRH homepage. And then I'll also just put in a link to Source, which is the organization that Kristen mentioned that really fosters community engagement. And there's a lot of opportunities that come through for students. And some students even do their field placement for the master's programs, for the MSPH program. They identify a placement through Source. And then I see a question for students interested in pursuing doctoral research in gender, life skills, and adolescent behavior change. How does this program support research preparation? So I can maybe take a stab at that one, and then folks are feel free to add on. I think that we do have a lot of graduates from our master's programs go on to doctoral programs. So I'm going to talk today primarily about our master's programs. We do have a PhD program as well, but the application cycle is closed. The application deadline was December 1st, so you're welcome to apply next year. But in our master's programs, we do have opportunities to engage in coursework that's related to research, as well as program management, evaluation, advocacy, policy, and so that I think that's another opportunity in the master's program to just explore those different areas of public health and see what you like. But you certainly can hone in on the research skills. There's a lot of room for electives, and you can pick and choose courses that might prepare you for a doctoral program. Anybody want to add to that? All right. Any other questions while we have our presenters here before I switch to talking about our programs and the application? All right. Well, before I let Kristen and Georgia go, I would like to take a moment and talk about Baltimore, which is where we're all based. And could I ask the two of you to share something that you enjoy about living in Baltimore?
Yes. Okay, can I give two answers?
Of course. How
Okay.
could you keep it to just one?
So I think I'm moving here from out of state. And I'm coming from kind of a larger program, a larger city. And so moving to Baltimore has offered me kind of a more close-knit environment, both in the department and just in the city in general. And I've made a lot of really good friends through our department, I'm in the Hopkins grad school housing. And so it's just been a really nice, like, kind of everyone knows each other. We're very supportive of each other. So that has been really great for like social and friendship wise. Um, and then just about Baltimore more generally, I really enjoy the proximity. I'm coming from the West Coast where everything is super far away. And so I really enjoy the proximity to other cities around the area. So my roommates and I just went and did a day trip in DC, went to a bunch of really cool museums and coffee shops and stuff like that. So really nice to get everywhere. You can go up to Philly, to New York City. So yeah.
Yeah, thanks. I'm from the East Coast, but I have definitely heard a lot of people coming from the West Coast or other parts of the countries that they're just like shocked at how close everything is together here. So many other cities are even just like a hour train ride away. In Georgia, do you live in the 929 apartments? Is that what you were? Cool. So that's the graduate student housing that she mentioned. Kristen, you want to say what you like about Baltimore?
Sure. I've been in Baltimore almost 7 years now. And I also moved here from a big city, the biggest city, New York. It was a bit of an adjustment because it really is a small city. It's about 500,000 people that live in Baltimore. But I agree with Georgia, like the smaller setting, everything feels really manageable. You kind of like know what's going on in a way that you might not in a larger place. Exactly, small to more. Even before everyone came on, I was like, Sally, I was driving through your neighborhood and I saw a long line. Like, what could it have been? So it's that kind of place where like people really know what's going on. There's like a very neighborhoody feel. And then I live very close to campus, similarly to Georgia, but I live south of campus. And I live 1 block from Patterson Park. And I don't know that I can ever live far from a park again. I think I'm so spoiled. It's a beautiful park. I have 2 dogs. So we walk them there every day. And it's just like a really nice place in all seasons to just be able to be outdoors. And you see people that you know, you see other students, other faculty. So it's really, if you're thinking about neighborhoods to come to, I definitely recommend being like in and around Patterson Park. You can walk to school, you can walk right through the park. And it's just really nice over here. So, yeah.
Thanks. Yeah, I'll echo that. I lived in New York City very briefly, and I one thing that I appreciate about Baltimore that I think is available in New York, but maybe I just didn't find it. But Baltimore has a lot of green space and a lot of different parks. So just over the weekend, I took my daughter to a nature center, and I think it's really easy to feel like you're outside of the city, even when you're still in the city, which is something that I like being from a smaller town. All right. Well, thank you so much to Kristen and Georgia. We really appreciate hearing a little bit about your work and that exciting project. And thanks so much for sharing a little bit about Baltimore as well. So you're free to go. And I'm going to turn now to talking about our programs and the application process. So thanks.
Thank you, everyone.
All
Thank you.
right. All right. So let me go back to sharing my screen. Um, So, like I said, I'll focus on our master's programs today. I have one slide about our PhD program if that's something that you're interested in for the future. But before I talk about specific degree programs, I do want to just quickly note that both our master's and PhD programs are STEM designated, and so that has particular benefits for international students where you can get the STEM OPT extension if you are coming as an F1 visa student. And so there's more information on the website. We can also share out these slides to everybody who registers, but there's more information on the Hopkins website about that. And then again, wanted to highlight some of the career opportunities. These are particularly career opportunities that our master's students have found. So you can see that there are a variety of different positions, people going into policy, monitoring and evaluation, clinical research. We also, as I mentioned, have students who go on to doctoral programs and as well as medical school. So a lot of folks do go on to medical school after our program. And this is just one recent alumni who got a job as an epidemiologist after she graduated from the MSPH program. And so in this quote, she shares that she's really pleased that the position that she was able to secure after graduation. So here are our degree programs. Like I said, we have a Master of Science in Public Health, which is an on-campus full-time program, and it takes 2 years to complete. We also have a Master of Health Science program. This is a shorter program that can be completed either on campus on a full-time basis, and students do that in actually a little bit less than a year, in about 9 months, or you can be more flexible with that program and complete it online on a part-time basis, and students generally take up to 3 years to complete that program. We also have a PhD program based in the department that is on campus and full-time, and our PhD students receive 4 years of tuition funding, as well as a stipend that comes with a work appointment. I'm happy to answer questions about that, but like I said, the application period, the application is closed for the PhD program. And then I'll also just mention that we have a accelerated bachelor's MSPH program designed for JHU undergrad students. And so I'll talk a little bit about the timeline for this, but you have an opportunity to, as a Hopkins undergraduate, to apply between your junior and senior year. And then 16 credits or one term of coursework transfers to the program so you can finish up a little bit early. Let me talk a little bit more specifically about the MSPH degree. So, like I said, this is our on-campus full-time 2-year program. In the first year of the program, so both the fall and the spring, Georgia is in the first year of the program. It's really focused on coursework, including biostats, epidemiology, a lot of PFRH courses that focus on our program competencies within the department. And then after that first year of coursework, our students complete a field placement starting in the summer and going into the fall. And we can talk a little bit more about that, but students have the opportunity to engage in public health work that is of interest to them. Again, areas where you might want to explore or develop skills. And then our students come back in the spring. They can complete more coursework. Often that's mainly electives because students are able to complete most of the required coursework in the first year. So you have a lot of flexibility in that second year to take classes that are where you can customize what knowledge and skills you want to build. And then our students in the spring of the second year also complete a master's essay, where you get to select the topic, you get to select your faculty advisor, your faculty reader, and complete an essay or a final project that's really the culminating experience in the program and is generally really on issues that our students are most passionate about. So these are some pictures from our MSPH students on field placements in recent years. And like I said, there's a lot of flexibility. Students are responsible for finding your own placements, but you can do anything from travel abroad and engage with maybe research or advocacy partners to do work. Some folks also might choose to stay right here in Baltimore and do community-based work. Other students engage in in policy work with partners or monitoring and evaluation. So really just a big range based on your interests. And then here's a few examples of master's essays of recent students. Again, a lot of flexibility to select the type of essay that interests you. So some students will engage in a secondary data analysis. Maybe they find a faculty can serve as their reader and connects them to a data set, and you complete a data analysis. Often our students will go on to publish those. Can take a little bit of time after you finish the initial essay, but we've seen a lot of students having success there. You could also do like a scoping literature review where you just engage with the literature to learn more about a topic and compile that information into your essay. Uh, Other students can do a legislative position paper or even an evaluation of a program. Some students connect their master's essay to their field placement. So maybe you start a project on your field placement, or you engage in data collection or data analysis for your field placement, and you continue that work into your essay. But it doesn't have to be, it could be something totally new, not at all related to your field placement. As I mentioned, we have this bachelor's MS-PH degree designed for Hopkins undergraduates. So, like I said, you complete this degree program a little bit more quickly if you would like than our regular MS-PH program. So we have a term system here where instead of semesters, we have quarters. We call them terms. And so the MS-PH degree, you complete it in 2 years or 8 terms. But if you're a Hopkins undergrad and you apply to the bachelor's MS-PH degree, you can complete the master's portion in 7 terms instead of 8. And all majors are welcome. You don't just need to have majored in public health at Hopkins. You can come from any major. This is that same timeline, but for our bachelor's MS-PH students. So again, that first year is coursework. The summer and fall is the field placement, but our bachelor's MS-PH students start the master's essay a little bit earlier than other students. So you start it in the fall and complete it in term 3 instead of term 4, and wrap up a little bit early. I also want to talk about our Master's in Health Science program. So, like I said, this program is shorter in duration. So you can either complete it in 9 months, or you can do this on a part-time basis. You can be online anywhere in the world and complete it in up to 3 years. So the MHS program does not have a field placement, and some of the coursework is similar, but it's more focused on research methods, competencies. So we have some students who do this program who might have gone to medical school. Maybe you want to go to medical school, but you have a little bit more public health experience, so that field placement portion might not be as important to you. And so, but often our students are more focused on the research end of things and take a little bit more coursework in research methods competencies. So again, no field placement. You still do complete a master's essay. The requirements are the same as for the MS-PH degree. And to apply to the MHS, you do need to have 1 year of full-time work experience related to public health in order to apply. We also have a PhD program. Like I said, I'm not going to go into too much detail here because our application is closed for the year. But our PhD students take coursework in both PFRH content area, as well as a lot of coursework in research methods. And then there are also doctoral seminars. Our PhD students engage as RAs and TAs, and complete a proposal and a dissertation. So those are the degree programs that I'm going to talk about. I also want to note that all of our students are welcome to complete certificates while they're here. It's not mandatory, but this is something that a lot of students take advantage of. You can complete multiple certificates. And so these are just some of the certificates that are offered by the department. But if you go to the website with the certificates, you'll see that there's just endless opportunities. And I think it can be a nice way to find coursework in other departments and kind of build up your skills in an area that's important to you. I mentioned when we were talking with our presenters that there are a lot of centers at the school. And so these are the centers that are based in the department. I encourage you to go to our website and you can click on these centers to learn more. But again, these are just ways that faculty across the school and across the university come together and to collaborate. And there's often opportunities for students to engage with these centers. So this is a quote from another recent alumni who's working with PFRH faculty on projects that are really meaningful to her. I think that she was working here with Gates Institute faculty, so encourage you to explore those centers. I'll just touch very quickly on opportunities outside the classroom. So life as a student is about a lot more than courses. I think those courses are very important, but there's a lot of opportunities outside the classroom to engage with others in the department, including students, faculty, and staff. And so we have noon seminars, and you, I believe, are able to register for those now if you would like and view recordings on our website for previous noon seminars, and they cover a wide range of topics that are where everybody in the department just takes a lunchtime on a Wednesday to learn about something new. So this might be presentations from people within the department sharing their work, but we often have people from other places at Hopkins or even outside the university, community partners who come and talk about areas where they're working related to PFRH. There's a lot of social activities available. Some of those are organized through the Department Student Association, which is very active. We also have events on campus for students, faculty, and staff, including like a holiday party. We have snack and chats. You can see the people holding up, I think those are cupcakes in the middle picture. So just great ways to connect with people across the department. And then as you learned already today, a lot of our students engage in research assistant positions as well as teaching assistant positions. And those are nice ways to make money, but also develop relationships with faculty across the school and here in the department. We have a lot of support for our students. So everybody who comes here will have an academic advisor. If you come to the MSPH program, you would be in a group advising arrangement where once a month you and a group of 9 or 10 other students come together with your faculty advisor and talk about how the program is going. And that's an opportunity to learn from each other. You also have access to your advisor outside of those group advising sessions, but I think those are a nice way to build community with your peers and get some support that you need. We also have program seminars. So we have a first year master's seminar that meets weekly, and we talk about everything from choosing courses to resources that are available in the school. We connect you with the Office of Career Services to learn about professional development opportunities. And then we also have a great education team here that is always available to support you. Kristen McCormick is on, and I bet many of you have already talked with her. And we also encourage students while you're here to really build a mentorship team. So you'll have your assigned advisor. I'm available, Kristen is available. But you are free to network in the department and in other departments across the school and university to think about the type of support that you need, who you want to learn from, and build that mentorship team. And here, Malik is also a recent alumni. She came from another university and shared that she really appreciated the support that she received from the department transitioning. I think from a smaller school to Hopkins was a little bit bigger for her, but in the department, she was really able to find her home. All right, I'm going to move to admissions info. I do see some questions in the chat. I see a question about applying for scholarships separately. I'll talk about that. We automatically consider our MSPH students that we admit to the program for scholarships, but there's also a need-based scholarship that you need to complete the CSS profile in order to be considered for that. Um, and let's see. Okay, I see Kristen answered the question about applying for certificate courses. And so Kristen is a great resource if you're interested in a certificate. Um, And then I see the question about you're specifically interested in adolescent health. Do you need to apply to a full master's degree program first, or is there a separate application process for the certificate course? So students are able to take some credits before you enter a degree program. You're limited to take 16 credits, and you're called a special studies limited student. And so some courses allow that, others may not. But we could help you through that. Also, Kristen, do you mind just sharing if somebody wanted to apply to a certificate before they come to before they're admitted to a degree program, how that works?
Yeah, I think you would just do it through special studies as a non-degree student.
Okay, great. Yeah, so if you are interested in
Yes.
that, feel free to reach out to us and we can help you through that process. I'm going to talk a little bit about the application for our degree programs. So the application deadline is right around the corner for our MSPH and MHS programs. You need to apply, get your application in through SOFAS by March 1st, and that would be for an August 2026 start. We encourage you to apply as early as you can because we do make decisions on a rolling basis. And I know that that is right around the corner, but you can do it if you're interested. You have a couple of additional weeks to get in all of your supporting documents, like your transcripts and your letters of recommendation, but you do need to submit that SOFAS application by March 1st. If we have any Hopkins undergraduates online right now, if you are a junior, you can apply this summer. The application opens later on, and you need to submit that by July 1st between your junior and senior year to be considered. If you're an international applicant, there may be some additional requirements for you depending on where you live, including an English language proficiency test, as well as credential evaluations. And there's a lot of information on the Bloomberg School admissions website, specifically for international students. So like I said, if you're going to apply to a master's program, you can complete the SOFAS application, which includes a personal statement, your resume, and work history. You also need to submit 3 letters of recommendation. We like to see at least one of those from an academic reference, and then all official transcripts from all of the universities that you've attended. If you are interested in that bachelor's MSPH program, you can complete the SOFAS Express application that includes similar components. And again, I just want to point out that if you're an international applicant, you may have some additional requirements. But for everybody, GRE scores are optional, so those are not required. So let me talk about funding. And I see a question about getting a scholarship. I would encourage you to apply this cycle. We still have scholarships available, and if you can always defer admission if you are not able to come this year, but you the need-based scholarship, we have not given any of those out yet. So you would submit your information, the CSS profile by March 1st, and you would still be considered this cycle for that. We all of our MSPH students who come and remain in good academic standing receive a 75% scholarship in year 2. So again, that is available to everybody. You just need to be in good academic standing. So have a GPA of a 2.75 or higher. We do have internal scholarships through the department, and those we consider, it's not a separate application process. We automatically consider all of our applicants for those scholarships. And then, like I said, once you're here, you also have opportunities to engage in paid work as research assistants and teaching assistants. We'll share these slides, but there is information available through the school on funding and scholarships, as well as cost of attendance and more information on living in Baltimore, including information on housing. I have just a couple more slides and then we'll get to questions. I encourage you to stay connected. You can look at or you can watch this info session and previous info sessions on our YouTube page. So there are info sessions that we've done over the past year or so related to specific topics within PFRH. So you could hear more about other faculty-student collaborations, again, to get a better sense of opportunities that are available here. But please follow us on Instagram, Blue Sky, LinkedIn, and YouTube. And then Kristen is available to answer questions as well if you haven't already been in touch with her. So I believe those are all of my slides. I'm going to stop sharing and see what questions you all have. Yep, so the need-based scholarships are open to anybody. You could be US-based or international. See a question about deferring. Yep, so you can, if you are admitted to the program, but decide that you want to wait a year to start, you can let us know. Kristen, is there a deadline to do that?
Might be. I'd have to check on that.
Yeah, I think that we
Maybe it's
can.
April 15th. I'm not sure.
Okay. Yeah, we can work with you if you are admitted to the program and decide that you want to defer a year. But yes, it is, you would tell us if you want to come next year, and then if you didn't come next year, you would need to reapply. So it's just for 1 year. And I see somebody asking about interested in the PhD. When we reach out to faculty to make connections, should we be looking at their research or the research of the center they may be associated with? Is it more beneficial to connect to potential PhD advisor or center that has a research focus you're interested in? Yeah, so for the PhD in particular, we really do make those admissions decisions based on fit and opportunities that are available in the department. You don't have to reach out to faculty in advance of applying. You don't need to find your mentor. We do that for you. You're welcome to reach out to faculty to learn more about their work. Especially if you feel like you're not sure that this department is a good match for you, you could reach out. But my recommendation is really just to look at the website. I would say look both at the faculty profile as well as the center where faculty are working. And talk about that in your application when you find opportunities that seem like they would be a good match for you. And but you do not need to reach out to people in advance and engage with them. That's definitely not required, and it's perfectly okay if you don't do that. We will facilitate those connections for admitted students. And then I see a question about the need to apply separately for the need-based scholarship. So you do need to complete your CSS profile, which basically asks information about your finances, and that's how the school determines eligibility for that scholarship and your level of need. So you do need to complete that, which is separate from the SOFIS application. I can try to find that link. What other questions do people have? Feel free to come off of mute or type it in the chat. I see the question about whether it's helpful to reach out to faculty before applying to the PhD. Like I said, it's not necessarily going to help your application if you have reached out to faculty and corresponded with them. We don't expect our applicants to have done that. You're welcome to do that. I can't always guarantee that all of the faculty you reach out to will respond. But I really only recommend reaching out to talk if you are not sure that this is the right place for you and you want to get more information about faculty work and assess your fit. But it's perfectly okay if you just research people online and write about that in your personal statement. That's not going to count against you. We have a few more minutes, so we'll stay on as long as the questions keep coming, but if not, we'll go ahead and end. So any final questions?
I think there was a question in the chat. Is there any work experience required to apply?
Okay. So if you want to apply to our MSPH program, you do not need to have any work experience. We have a lot of students come to our MSPH straight from undergrad. That was the case with Georgia, who just shared that at the beginning of this session. If you're interested in our MHS program, so the one-year program, you do need to have at least 1 year of full-time work experience. So, a question about the visa process for students. This is going to vary depending on where you're from. We have an Office of International Services, and they are the best resource to support you through that process. I'll say that there is a lot. The Office of International Services proactively reaches out to all of our international students who are admitted to the program, and they can walk you through all of that. We're happy to try to help, but it's really OIS, the Office of International Services, that it will assist you through your visa process. I see a question for the PhD. Yep, you can ask questions about the PhD program. Just want to be clear that the PhD program, the applications close December 1st. And so if you're interested in the PhD program, you would be applying to the next cycle where students would start in fall of 2027. Um, Could we put the LinkedIn, if you could, we can put our PFRH LinkedIn in the chat. If you are interested in applying, you can always get help from the admissions office, and then we're available to answer questions that are specific to the department. Um, so, love, to get a visa, you need to contact OIS. Let me put that in the chat. For the PhD program, the application is fairly similar to what I explained for the MSPH program. So you would apply through SOFUS. You need a personal statement, transcripts from all of the universities you've attended, at least 3 letters of recommendation. The GRE is optional, and then for international students, there might be some additional requirements based on where you live, including getting all of your transcripts credentialed from non-US universities, and you may need to take an English proficiency exam. And there is an application fee. That information is all on SOFUS. The department does not provide application waivers, but SOFUS does. So I would look at the SOFUS website for information about waivers through the SOFUS organization, but we do not provide application waivers. And so, Chris, I see we'll put in our LinkedIn, and then I'll put in my email address. You can also find us find our contact information through the PFRH website. Let me put that there again. And I see Kristen put her email address in. No, you do not submit your letters of recommendation yourself. You would put in the contact information, I believe, for your recommenders into SOFUS, and they submit them directly to SOFUS. So you do not need to collect your letters of recommendation and submit them yourself. Your recommenders send them directly through SOFUS. All right. Well, we have the list of folks who registered for this session, and we will send out the recording as well as the slides that have a lot of links in them. I see one question about applying to teaching assistant and research assistant positions. You would apply to those once you start. So faculty we can't hire students until you are here and matriculated in a program. And so my recommendation there is just to explore online where you might be interested in working, but wait until you're a student here to actually apply for those jobs. All right. Well, thanks so much for being with us. Like I said, we'll share materials. Please follow us on Instagram and LinkedIn and reach out if you have any questions. Thanks so much to Kristen and Mary Alice. I'm going to stop the recording.